Hello and welcome to Rappler Talk. I am Mara Cepeda. We are joined today by Marikina Mayor Marcy Teodoro, whose city government has received much praise for their successful efforts to contain the COVID-19 pandemic in their city. Hello, Mayor. Welcome to Rappler.
Yeah, hello Mara and magandang araw sa ating lahat.
Mayor, I'll dive right into my questions. Let's begin with what's the status of COVID-19 now in Marikina? What are the numbers? How many cases do you have as of today? How many recoveries? How many deaths? And kinakaya po ba ngayon ng health system ng Marikina yung pagdami ng mga kaso?
We have 325 confirmed cases and with that number we have 160 recoveries and we have 30 deaths. So more or less we have around 160 active cases now at this point in time. The real challenge really is having a robust or resilient health delivery system. We really need to improve on the capacity of our health services. The facilities of the hospital should be expanded in a manner that would address the increase in number of COVID patients. Kaya sa Marikina, what we did is to have an emergency quarantine facilities attached to a medical center, a level 3 DOH hospital. Unfortunately, or incidentally rather, with the expansion of the facility, would need additional personnel to man the quarantine facility. So the local government provided such support to the hospital in order for us to make the quarantine facilities operational. We have a 200 bed capacity quarantine facility in Marikina in order to accommodate all the cases that we're encountering as we go on with our enhanced targeted testing as our quarantine is being downgraded further from ECQ to MECQ, and now we are into GCQ. And so we're testing a target group, for example, tricycle drivers when we allowed them to ply their routes. Because of the increase of people going into our market coming from other cities, municipalities adjacent to Marikina, we tested 2,000 market vendors, porters, and helpers. And if we found or if we find somebody reactive to the rapid test, we subject the person to a confirmatory test, which is the PCR based testing. We're simply following the strategy proposed by the World Health Organization that we need to do first screening, and we do screening through the rapid testing or in an enhanced targeted testing or mass testing. After that, after the screening, we test. This is the testing being done with our molecular diagnostic laboratory or the PCR base. So after that, we treat. We provide the supportive medical treatment necessary for the person to recover from his condition or to avoid further deterioration of one health condition. And after treatment, what is very important, and I think most of us are missing this point, is the reintegration process of the person back to his family or to her family and to his community. So I think the challenge really is the reintegration process. And the virus is here to stay. The other challenge that we are encountering now is how to set all the protocols and how to implement the protocols institutionally in a structure, given a framework, uh, uh, to address the new normal that we have, in order for us not to get infected or to avoid unnecessary transmission of the coronavirus. So ito yung challenge natin. Of course, logistically, uh, we need to reprioritize everything in the budget of the local government, but it cannot be solved alone by the government. But uh, there should be what I call a whole of government approach, meaning we have a synchronized collaboration of the LG or the local government and the national government, not only in terms of policies, but in terms of resource utilization and management. Uh, what is lacking in the national could be supported by what we have in the local government. And what is lacking in the local government can be provided perhaps by the national government. Likewise, we need to also have a whole of community approach, that everybody should have a stakeholder ownership of what we're having now. Kaya the I think what is important at this point is that, of course, we should listen to the experts, to our economic experts, to our health experts, for them to provide us with a template or a framework on how to proceed in combating the threats of COVID-19. But more importantly, I think, in order to be practical about it, um, and I think what we should really exercise is common sense at this point in time. We should, I think, listen to the people.
Mm-hmm.
They know what condition they are into. They have their own stories, and I think we in government, for example, me as mayor, should be able to listen genuinely to what the people will say, what they feel, what they need, the solutions they think uh, uh, that would be necessary to address the problems that we have. I think this is what we're lacking at this point in time. I'm very happy that we're having this Rappler Talk interview. This is one format or a forum wherein ideas can be exchanged freely, and new options can be discovered uh, through dialogues.
Mm-hmm. Okay. Mayor, hihimayin ko lahat ng iyong mga sinabi in the past few minutes. But let's just go a little bit back. Marikina has been considered as a model city. I'm curious, what was your mindset at the start of the pandemic, especially in terms of mass testing, containment, and eventually, looking ahead and envisioning what the government needs to provide to the citizens. As you mentioned, naisip nyo agad paano yung integration process. How are we going to feed our people when they are put under lockdown? What was the mindset that you have, and how did this help define the way the city government has responding to the health crisis from several months back until now? Kasi mabilis po ang response ng Marikina. That's something laudable for your city government.
It's the predisposition, perhaps, on my part to be with my people at the outset. If you would notice, I did not become a viral, what you call that, uh,
Viral online mayor.
no. I did not become a virtual mayor.
Ah,
A virtual mayor that you could only see on screen, on Facebook, or communicating
social media.
through social media. I see to it that I'm on the ground on the first day, and up to now, I simply practice social distancing. I follow strict health protocols. Um, but I see to it that I'm on the ground. I'm in the community. I visit communities. I go to our public market. Try to talk to the people in the market. I try to visit some homes when we're distributing the social amelioration program, the SAP. Kaya nalaman ko talagang kulang na kulang, kulang na kulang. But prior to the distribution of the national government, we have a local social amelioration program based on the firstly affected by the IATF guidelines when they first suspended the operations of the malls. So we provided social amelioration to our displaced workers from the mall. Yung mall located in Marikina, yun. When they suspended the operation of the public utility vehicles or public utility jeepneys, we provided some assistance to our public transport sector. So, ano lang talaga, you should be able, I think, to not simply read but follow the development of the in the pandemic, kung ano yung nangyayari, unfolding of the events. So, I think, yun lang, ganun kasimple lang, hindi naman talaga komplikado. When we first thought of putting up a testing laboratory, I simply listened to what I heard from the news. Sa Rappler ko pa yata nabasa. Sa Rappler ko pa nabasa yung declaration of WHO that there's a pandemic. And what the health experts are saying that we should be able to test so that we will know who are the people we should treat. Logically speaking. Then, more importantly, if we are able to treat or able to test, we should be able to identify those people we need to isolate and contain in order to avoid further transmission of the coronavirus. So yun lang ang thinking namin. So how can we do the testing? We can do the testing by putting up a molecular diagnostic laboratory, and anybody could put up any LGU could put up a molecular diagnostic laboratory. We simply follow the template provided by the WHO and the DOH. They have a template for putting up or establishing a molecular diagnostic laboratory. We need the person. You need to identify your personnel, the equipment that you need, the protocols, the trainings, the biosafety protocols. So, yung ginawa lang namin. Unfortunately, the DOH see us as a client applying for a license or accreditation. I was telling them that we should not be treated as a client applying for an accreditation or a license to operate, because there's a crisis, there's a pandemic. The situation, the condition is different that of the normal, under normal circumstances. There's urgency. So we were advised to simply get a specimen and submit it to RITM. But what we foresee then is that dadami yung kaso Dadami yung kaso
At doon nga yung backlog, 'di ba, Mayor, dahil lahat dinadala doon sa RITM.
Kasi how many cities do we have? Not only in Metro Manila, how many testing center do we have, di ba? So sabi ko, tiningnan ko naman, di naman ganun kalaki yung kakailanganin. Kailangan ko lang talaga na magaling na molecular pathologist para siya makipag-evaluate, makapagbasa ng result. So then we simply decided to put up the laboratory.
Mayor, how difficult was it really to convince the DOH and the national government to have the lab accredited? Maybe you can run us through the process. I mean, you already described you met
there's a very old law. It's an archaic law passed way back in 1960s, I think. 1960s, during the time of President Marcos. requiring anybody, both government and non-government, private, to secure an accreditation or license to operate from DOH. So I think that's the basis of the DOH then. Why the DOH is requiring us to have a license. But I'm invoking not only our local autonomy, but the declaration of the president that there's a pandemic, there's a national health emergency, and as a as a local chief executive, we are mandated to exercise all our powers, authorities, resources, either incidental, necessary, to arrest the transmission of the virus. And the first step, really, according to WHO experts, is to be able to test.
Mm-hmm.
So, so I simply follow that logic, na we need to have the testing capacity, and how to have the testing capacity is to avoid dependency. Uh, uh, Dependency in terms of where to test or where can we avail of the testing. So we decided to put up our own laboratory. I'm not expecting that um, it will be that difficult or that tedious because of the current the condition that we have, having a national health emergency. I'm always saying then that there is a sense of urgency. There's
Mm-hmm.
this urgency actually that we need to do the testing. Unfortunately, we're delayed for almost a month before we could do the actual testing. If you could remember, we put up two laboratories
Yeah, you
in
did.
order to convince DOH. I followed everything that they said. Everything that they required from us. So I think at the end of the day, they found no reason why not to approve our system. Actually, our PCR is an open system. It
Mm-hmm.
could use any type of testing kit.
Oh,
Uh,
regardless of brand.
it's not, yeah, regardless of brand. Unlike the testing center accredited by the DOH, that there's a proprietary, I think, it's proprietary, I think, that it's a closed system that it could only use a particular brand. And my mindset then is that we should be able to democratize testing,
Mm. Why?
particularly to provide access for those coming from the marginalized sector, from the poor communities, people who have no access to testing because they cannot go to a private hospital, very exorbitant yung price ng test. After the test, there's treatment pa eh. There's treatment pa. Kaya nga sa Marikina, libre yung test namin eh. Whether it's rapid or it's PCR, libre to, libre. It's really for everybody, para sa lahat. Particular, lalo na dun sa mga mahihirap. Kaya nga, ang isang sector na tinitreat namin, yung workers eh. Nung mag-GCQ, we conducted mass testing in factories, in different industrial settings that we have sa shoe industry, public transport, yung mga hindi walang ibabayad sa pagpapatest.
Mm.
So, naging part of the regular health service namin yung testing.
Okay.
Tapos na, dahil may quarantine facility naman kami, doon na siya nagpupunta for treatment at ano na siya at uh, libre na rin siya. It's for free. Yung ibang wala, I asked my city council to provide authority to the mayor in order for the mayor to extend assistance to those COVID infected with coronavirus, mga COVID-19 na patients. Of course, yun sa mga ano yan, yung mga uh, yung mahihirap talaga. Kasi hindi apektado siya, hindi siya makapagtrabaho. So, yung panggasto sa pamilya na kailangan. So, we also support them with that with the means to provide for the family.
Mayor in Marikina, who gets to be prioritized for testing first? You mentioned yung mga may hirap talaga, those who can't afford to get
Uh,
themselves tested. Ang isa
no,
sa ang mga prioritize niyo, Mayor.
priority namin talaga are those with exposure to
Mm.
COVID-19. So kasi ang idea talaga is to avoid further transmission to transmission. So ayun, yung may mga exposure. Yung mga dating tinatawag nating PUMs at PUIs. I think there are still PUMs and PUIs. Binago lang ng DOH yung category. I mean, okay na sana for purposes ng identification saka alam mo kung paano mo i-categorize. Pero binabago nila So pero kami, that's how we see them. It's either your PUM or PUI, yung may exposure. Yung mga OFWs at the early stage, nung wala pang testing sa national, so sila, pag umuwi dito sa Marikina, yung mga OFWs natin, at the outset, during that period, ayun, kino-quarantine namin sila, tapos tinetest. Dahil nga may sarili kaming testing facility o center, the result can be out within 24 to 48 hours.
Oh, that's
Uh,
fast.
so eventually, at the earliest stage, they can be reunited with their families. Unlike what's happening at this point na nagtatagal ng 2 linggo, minsan isang buwan. I mean, the problem really with this COVID-19 is not only yung medical condition but the mental health also is suffering yun ang nakikita namin, malaking problema nito nag-quarantine ka na matagal, yung ganon. Yun ang nagpa-prioritize. Frontliners, yan, mga medical health workers natin na pinaprioritize natin
Mhm.
sila. Ngayon, ang priority dun sa confirmatory testing natin o dun sa PCR-based testing natin ay yung mga nako-contact trace natin, una.
Mhm.
Pangalawa, yung mga nagre-reactive. Ito yung isang uh, uh, differentiation na hindi pa alam ng marami. Kala nila pag naging reactive ka sa rapid test, is positive ka na sa COVID. No, di ba? Rapid test basically is a screening tool. Yun ang in-employ namin strategy because there's a physical impossibility to test everybody using the PCR or swabbing. It's a very painful procedure at the outset. Pero, ayun. Uh, ayun, yun ang tinetest namin ngayon sa ano namin sa
Facility.
sa facility namin. Siguro na kami, naka 8,000 or 10,000 kaming na swab na.
Wow.
Uh,
That covers what period, Mayor?
uh, since we opened the center. So around siguro second month na ngayon, second month na ngayon. Actually, paubos na today yung ano namin, yung test kit namin. We purchased 10,000 test kit
Ah,
So paubos na kami ngayon. Today is our supply will need to be replenished. So
bibili kayo ng
I ordered
mag-supply
station.
kayo niya.
Yeah, yes. Oh. Tapos siguro naka 25 uh, thousand kami na rapid test
Yes.
kits na. Oo. Na
Wow.
we conducted that number. Kaya kami 300 mataas na 'yon. Nakuha na namin 'yon dun sa mga mass testing na ginawa namin. Minsan nag-test kami sa palengke, 66 ang nag-reactive. Ibig sabihin may antibodies sila.
Opo.
Antibodies. Yung antibodies tumaas dahil may viral infection. Yung virus, pwedeng hindi COVID o hindi coronavirus. Pwedeng SARS, pwedeng influenza. Nung sinubject sila sa confirmatory test, 29 tested positive. It's a big number, I must admit. Pero for a public market, na thousand of people going into and doing, I mean, for the whole day, almost 24 hours, ay sabi nga sa akin isang nagtitinda sa palengke, buti mayor na test agad.
Mm.
Sabi rin ng mga health experts, buti may test, nakakapag-test tayo agad. Kung hindi, baka exponential ang dami. So na-contain namin agad. Ngayon we have parang coding in our market, number coding. Pag ang install mo even number, may designated day ka for your selling. Pag ads ka naman, may designated day ka. So alternate sila. The idea there is to provide enough distance for buyers or to the market. Space ang kailangan natin eh. That's what we need to exercise social distancing. It's either space or you lessen the number of people in an area where they would congregate.
And Mayor, this is especially important for yung market sa Marikina because hindi lang naman po Marikenyo yung nagtatrabaho at pumupunta. Some
Yes,
come from different cities, so they could be
yes.
bringing in the virus.
Mara, ang totoo, yung 29 na infected, ang karamihan pa ron, yung infected na mga helpers yung subgroup na yan, nag-contact trace kami, yung source hindi pa taga Marikina. Tapos majority of those 29 ay hindi taga Marikina. Kasi yung palengke namin, tawag nila bagsakan. So, mas mura yung presyo ng mga gulay, ng mga paninda nanggagaling sa Nueva Ecija, yung mga isda nanggagaling Batangas, Pampanga, Bulacan yung mga baboy. So, this is a very old market. It existed even before the war. So, naka-establish na yung network niya. So, ang mga nagtitinda rito pati, hindi rin lahat taga Marikina. May taga Pasig, taga Antipolo, taga Quezon City. So, pero we treat them as if they are Marikina residents when they get infected. Ganun talaga tingin ko cross borders how we could best deal with COVID-19 is through cooperation among cities, I think. Not only in terms of sharing data, but more importantly, to have a comprehensive, interconnected, in a network surveillance of infected. Similarly, I think time will come. There would be inter-LGU cooperation that will happen in putting up medical facilities. For example, we tried to put up a medical facility exclusively for COVID patients, but Marikina cannot solely bear we cannot fund or we cannot have the budget to establish and operate. We could establish perhaps, but to operate it in the long run, we cannot. So I think if LGU would realize that we need to establish a robust and resilient health delivery system, I think we should be able to put together our resources and put up the facilities and the system where we could best serve our constituency.
Mayor, in terms of contact tracing, what's the strategy in Marikina? Kasi for example, dyan po dun sa mga market vendors and helpers, na-trace nyo po agad hanggang sa bahay. And we understand this doesn't happen nationwide. In fact, the national government is hiring more contact tracers. Sa Marikina po ba, sir, do you have enough contact tracers? And ano po yung ginagawa nyo para mabilis yung natitrace? Because we understand this is very important in containing the disease.
We have we hired qualified contact tracers na dun sa surveillance unit namin, dun sa City Epidemiological and Surveillance Unit. Konti lang sila, tama lang yung number nila. we tap the barangays eh. Uh, we we uh, we have our barangay officials attend orientation seminars on how to identify symptoms
Opo.
or read symptoms of COVID-19, the protocols that should be done, uh, the mandate of the law on reporting notifiable diseases and health events. So, yung mga ganito, we involve the community primarily. There should be community engagement eh. Ititingin ko yung problem sa national eh. Baka yung community hindi na i-involve.
Mm-mm.
And we try to be very transparent with our data. Kasi kung hindi ka magiging transparent, how can you do effective and efficient contact tracing? Ang magsasabi pa rin kung sino yung nakausap, nakasama ng taong infected, ay yung katabi rin niya eh, yung kapitbahay niya, yung mga ganon. So, pero at the outset, sa Marikina, ang iniwasan namin is yung stigma nung COVID eh. In fact, we legislated it eh, na there should be no discrimination of people with COVID-19. So, yung mga ganon. So, and we educate in terms of, we explain this in different fora, na yung COVID, yeah, it is contagious, it is infectious, but hindi naman siya nakakamatay na katulad ng inaasahan natin. Yung recovery rate, yung survival rate ay mataas compared to the death rate. So, yun. Tapos how do we get infected? How do we get infected? And explain natin sa mga tao. So, naintindihan na po, unti-unti, alam nila kung ano gagawin. So, ayun. So, nagre-report sila. We provided them with the means and the avenue where they could report the yung cases. Yun nga lang, may filtering kaming ginagawa kasi syempre, ang Pilipino, may marinig doon, mahilig, sasabihin na niya agad, di ba? Which is, I think, yun din ang strength niya at this time of the pandemic.
Mm-hmm. Mayor, this is one. How do you take care of the mental health of your people? You mentioned it already. For example, if I was quarantined for about 2 weeks, and we're dealing with the pandemic. Dealing with the pandemic is already difficult as it is. Tapos maka-quarantine ka pa. How do you take care of the mental health of your people in the middle of this pandemic? What do you have any programs?
Uh, for example, may quarantine facility kami. We provide them with a means of communication. Naka-quarantine ka, kung pumasok ka ron, wala kang cellphone, we provide you with a cellphone so you could at least send message to your family or ano. Or minsan, ako, personally, Mara, kanina, actually, meron akong appointed time, an hour or two in a day, to call to those infected COVID patient. Kumusta ko lang. Yun lang. Nakakatulong yun eh. When you feel connected. Kanina, I called yung mga frontliners natin from the PNP. Tinawagan ko sila. I'm surprised, PNP personnel. I mean, an officer. I called him up. And he almost cried while talking to me. Mayor, thank you. Thank you. Hindi ko na-expect, tinawagan mo ko. Salamat. I'm supposed actually to provide or to give assistance to them. Kanina, padadala ko. I provided them, Mara, with cash assistance. Pero kanina, narinig ko umiyak, parang masaya na siyang tinawagan ko. Munti ko na nga hindi binigay yung assistance. Para sabi ko, okay na pala siya. Pero we provided still the assistance. So, yung mga ganon. Uh, hindi kami rin nag-issue ng quarantine pass sa Marikina. My reason is this, Marami nagko-question sa akin bakit hindi kami nag-issue. Tingin ko limiting kasi yung quarantine pass. I-issue mo doon sa isang tao for a period of 30 days or 2 months. Parang siya lang ang allowed na lumabas. Kami, mahigpit kami dun sa pagsita or pag-implement ng quarantine. We only allow people who need to access to essential uh, services. So, parang ganon, we see yung sa mga tao, sa mga pamilya, nagkakaroon silang rotation. Minsan,
Mm.
sa araw, yung tatay ang lalabas, minsan yung nanay. So, you allow them this liberty of freedom to access to essential services. So, they felt empowered in a sense na hindi sila nalimit nung pass na hawak nila. Aside from the fact, of course, pag tinignan mo yung record namin sa DOH, WHO, ang deceleration rate namin is, o case doubling time namin is 11.7 days. So, mataas compared to others. Isa kami sa may pinakamabilis na deceleration rate. Pero wala kaming quarantine pass. So mukhang hindi doon sa quarantine pass talaga ang solusyon eh. Plus the fact, alam mo, quarantine pass, nabalitaan mo, binibenta ng barangay, inaabuso ng iba, pine-fake nila. So, tinuruan mo pang mag-tamper, mag-forge yung tao ng quarantine pass. A person can be honest na paglabas niya. What we inculcated in the minds of our people is that uh, you should be careful with yourself. We exercise quarantine measures for our benefit. Hindi to regulation lang na kailangan ipatupad. So, parang ganun yung isip namin.
Mayor, you've been a source of strength for people in Marikina, but how are you coping in the middle of this pandemic? You have a very tremendous job at hand. How are you taking care of yourself? Are you still able to spend time with your family?
I call them from time to time. During the quarantine period, kasi wala pa kaming testing facility no center, I did not, I spend my time separated from my family. So, para lang walang, kasi, ano ka eh, I never thought that I'm considered as a frontliner in my case. Kasi araw-araw nasa labas ako, doing so many tasks. So, naisip ko, frontliner pala ako. I might be endangering my family, my wife, and my two children. I have a 7-year-old daughter and a 1.5-year-old son. So, mahal ko sila eh. So, ako naman, I made the sacrifice na to be away from them. Mahirap eh. So, pag may nagsasalita, nurse na naka-assign doon sa ospital ng 2 weeks o yung rotation niya, yung Bureau of Fire personnel namin nasa checkpoint doing decontamination activity. Pag sabi mo, Mayor, hindi ako makauwi ng 2 weeks. Pag uwi ko pa, kailangan ko mag-quarantine ng 2 months kasi para walang testing pa nun eh. So, naiintindihan ko kung ano yung sinasabi niya. So, sabi ko, kailangan talaga ng testing para malesen yung time na i-quarantine ka pa. We have doctors who volunteered na nag-spend ng 1 month. Pagkatapos ng 1 month sa ospital, hindi umuwi. Nag-quarantine pa ng 2 weeks. Napakahirap. How am I coping? Your strength comes from the people you serve. I think that's the bottom line. Ang mayor, isa lang naman eh. Hindi kami dalawa. Wala. I mean, kailangan kong gawin to eh. Is this the best time to be a mayor? I think this is one of the most challenging time to be a mayor. And I think this is the best time to be a leader of your community. You're given the opportunity now to unite your people, to put them together, and to act as one, as a community. Hindi ako magaling na mayor at the outset. Hanggang ngayon, di naman ako magaling na mayor talaga.
Many would disagree.
Ang tingin ko magaling, taga Marikina. Taga Marikina, Mara. Taga Marikina. If you go here in Marikina, if you visit our place, wala ka makikitang pangalan ng mayor. Wala ka makikitang picture ng mayor outside the city hall or even inside of the city hall. Because sabi ko nga dahil sinasabi ko sa mga taga Marikina, lahat tayo may ownership, may stakehold. Kung ano man ginagawa ng pamahalaan, hindi pamahalaan ng mayor, pamahalaan natin to atin to. We will survive this pandemic together as a community.
Mhm.
I think yun yung kakaiba dito sa Marikina. Before I make any decision, as much as possible, I try to consult as many people I can consult. May galit din sa akin, syempre, mga nakalaban ko sa politika. Pero nakiusap din ako sa kanila that this is the time to set aside politics, our differences in politics, and we work together. So I asked them to help me, to help everybody now to to do yung roles that we should uh, exercise.
Okay.
Marami rin kami rito kasi mga volunteers, Mare, mga tao na
Mhm.
nagbigay kami ng food assistance. Minsan may binibigyan kami isang bahay, nagbibigay kami ng 5 kilos of rice plus ilang piraso, ilang canned goods, ganyan. Meron isang kaming binigyan, tumalikod sa amin. Kala ko nagagalit dahil kung ano dahilan. Pero nung aalis na kami, hinabol kami, nagbigay siya ng 1 kaban of rice from his house. Sabi niya, oh ito, hindi ko na kukunin yung binibigay niyo. Idagdag niyo doon sa pwedeng ibigay doon sa iba. That's how we're going to survive really this condition. Uh, Maraming mahihirapan definitely ngayon dahil maraming displaced maraming displaced maraming nawalan ng trabaho at marami pang mawawalan. We could not deny the fact that in the coming days and months and years, I think uh, the effect of the pandemic will be still felt. Kaya kailangan magtulong-tulong lang eh. And I think more people will go back, will come back to their families and be together. And that's how we're going to survive as Filipinos. Eh. Yung
Okay.
lakas natin nasa pamilya eh. Doon tayo bumabalik eh. Kaya
Mhm.
nga kami dito, yung balik probinsya, kausap ko lang kanina yung aking mga department heads. Sabi ko, we should be able to put up a system where we could effectively and efficiently implement yung balik probinsya program.
Mhm.
Para yung mga narito sa Marikina, halimbawa gustong bumalik sa probinsya nila and to be with their families dahil dati dito nakapagtrabaho sila. Ngayon nagsara yung kanilang establishment. So marami ganun ang ginagawa ngayon. At
Mhm.
marami rin mga taga Marikina na dati nasa ibang lugar nagtatrabaho, bumabalik, umuwi ngayon dito.
Mhm. Mayor, winding down to my last few questions. How was it like implementing the social amelioration program of the DSWD? Kasi we understand, sir, may problema dun sa listahan because they based it on an old 2015 survey.
Yeah, correct. Oh. We submitted a list of beneficiaries. We counted the number of households we have in Marikina. Ang ginawa namin yung low-income household.
Mhm.
Pero practically, we identified all households. We have around 119 households. Each household might have multiple families living in one household or in a household. Pero for purposes of equity, so tinreat na lang namin one household, one unit of the social amelioration. So, ganon. Regardless of whether dalawa o tatlong pamilya ka. So, sabi namin, pwede naman siguro magtulong-tulong na sila. So, maximum amount of 8,000 per tranche. So, kung dalawang tranche, so 16,000. So, ganun ginawa namin. We submitted this to PSWD. Incidentally, yun nga, they based the grant, the allocation on a 2015 census. which is not updated in the first place. So we received less than half of the number of households we submitted, 40%. So the challenge really is whether to give, the question in my mind then, similar to the other mayors, whether to give the social amelioration or not, or to wait for the additional social amelioration that will be provided by the national government. Yung and how to distribute it, uh, uh, practicing the health protocols. Uh, at the end of the day, I decided to distribute it anyway, miski kulang.
Mm-hmm.
Miski kulang. Naging honest na lang ako sa marami na ito lang yung binigay sa atin eh. So, nung dinistribute namin, kinatulong namin yung mga homeowners association, community association, kasi mas kilala nila kung sino yung mas mahirap, sino yung mas nangailangan sa mga area nila. Yun nga lang, ang problem namin, nag-explain kami sa ground, nag-explain kami sa community. Ito lang yung natanggap natin. Gagawin natin, tulong natin para sa pamilya. The problem is the pronouncement on the national level that everybody will have. Solo parent, senior citizen, PWDs. So may dissonance on the pronouncement and what we're actually implementing on the ground. Okay sana kung may abundance of of allocation. Kung sobra-sobra. Pero kung hindi, you need to really to prioritize. Nevertheless, we stick on it. Nasabi namin, ito lang yung meron tayo. Ang local government naman nun, nagbibigay din ng social amelioration. Pero pinapaliwanag, pero maayos kasi yung pagkakabigay namin sa local government. Kasi doon sa affected. O, driver ka na walang katrabaho, bibigyan ka. Jeepney driver ka na walang katrabaho, bibigyan ka. Nagtatrabaho ka sa mall na walang katrabaho, bibigyan ka. Ganun. And we asked some of the establishments in Marikina to help us in providing assistance. Yung mga shoe manufacturers namin, aside from the local government assistance, nag-provide din sila ng assistance. So pinagsasama-sama namin yung mga assistance. So we're ano naman kami, I think we're one of the first local government units na nakatapos i-distribute yung first tranche. Kaya nga, pagkatapos ay ma-distribute, in-announce ng DSWD 100% na nakadistribute na kami. Nagalit na naman sa amin yung tao dahil sinasabi, hindi pa naman nabibigyan lahat. Why are they saying na 100% nabigyan? So we need again to qualify it na nabigay, 100% nabigay yung 40% na inallocate sa atin. So yung additional, we're waiting still and hopefully it could be given at the earliest possible time. Ako naman naniniwala ako na importante yan as a stimulus, economic stimulus. It could help our local economy, our commercial economy, market economy. Yung mga maliliit, yung tao, may pambibili sa karinderya, may pambibili sa mga palengke, may pambibili sa tindahan. So may perang iikot. Yung may karinderya, bibili sa palengke. So dugtong-dugtong na. Yun nga lang, we cannot survive primarily on a long-term basis doon sa mga ganitong assistance program. Kailangan talaga ibalik na natin yung trabaho. Sabi nila, ibinalik na. Pero bakit hindi pa nagre-report ang marami? Wala kasi masakyan yung mga workers natin eh. Hindi rin makapasok. Yung kikitain, parang kukulangin pa doon sa pambayad doon sa taxi or sa pwede nilang sakyan, or because of the distance, it's hindi imposible na makapasok. It's a whole of government approach really, and a whole of community approach. The solution to the problem, I think, is systemic. Systemic. What we're simply doing here in Marikina is we're simply tending to our own garden. Kung ano yung kaya namin, pinipilit na namin ayusin. Pero alimbawa nito, meron akong mga kababayan, magtatrabaho sa Makati, magtatrabaho sa Taguig. Problema nila, sasakyan. yung libreng sakay namin, hindi na naman may extend hanggang dun sa labas ng Marikina kasi problem on resources. So, kaya namin, halimbawa, maglibreng sakay lang sa loob ng Marikina. So, yung mga nagtatrabaho sa loob ng Marikina, natutulungan namin. Pero sabi namin, kung may mga nagtatrabaho sa labas, carpooling is a good alternative. Ako, sana mabalik na yung mga traditional jeepneys natin, yung mga buses natin, para naman may mode of transportation sila magamit. Meron kaming bike lane sa Marikina, pero syempre, yung bike lane namin dito lang sa loob eh. Oh, paano kung lumabas ka na ng Quezon City, lumabas ka na ng pumunta ka Mandaluyong, for example, paano ka magbibisikleta sa EDSA, di ba? So definitely hindi pwede yun. So you need to have transport to operate a transport hub. So we're trying to survive together, I think. And in the process, I think we're doing relatively, I think, I don't know, we're surviving.
Mayor, as a local chief executive, how do you strike a balance between implementing the rule of law, but at the same time showing compassion to your people who you're very aware are struggling because of this pandemic?
Uh, Ako naniniwala ako, laws and regulations are not fixed. They should evolve with the people eh. What the people need, what the people want. Kaya ako from time to time, we will make adjustment on our regulations not to compromise the good of the majority or what is really essentially necessary. Yun yung balance. There should be communicability of your policies and public testability of the policies. So, sabi ko nga, you simply need to listen to the people. Like, you should need a genuine dialogue. Ako, hindi ko na sinasabing magaling kami doon or sinasabi kong na-exercise ko palagi. Pero it's on the top of my mind, yun ang iniisip ko. Any decision is not perfect or cannot be perfect at all times. But as much as possible, we approximate kung ano yung kailangan talaga. May rule of thumb, yeah, correct. I think that's a problem of DOH. Yung rule of thumb nila. Di ba? Ano iba yung situation ngayon Minsan, historically, they will study the pandemic that happened 100 years ago, the Spanish flu. Pero iba yung condition yun Iba yung technological advancement natin na sa ngayon Iba yung empowerment ng tao ngayon So, ang solution is hindi na monopolize ng isang institution na lang that's what I understand kaya importante yung flexibility talaga yung flexibility yung ganon, and that's what we're exercising here in Marikina. Halimbawa, nagsalita ako, may pronouncement ako, may minority may kumbaga parang may minority report meron talagang antithesis to the thesis So, I try to listen and try to look into doon sa antithesis na yon. Sabi nga sa akin, Mayor, hindi ka ba nahihirapan ka na, pagod ka na, may pandemic, hirap na, tapos may kontra pa, may oposisyon pa. Sabi ko, hindi ito naman personal yung kako. Tingin niya yun And we try to understand. How do we understand? How do we look into their perspectives? We put ourselves into their shoes. Diba? Tingnan mo kung paano ka maging tricycle driver na hindi ka namamasada. Tapos asawa mo nasa bahay lang. Saan ka kukuha ng pangkain? Kaya nung may guidelines ang IATF, binigay na nila sa local chief executive yung decision whether to allow the operation of the tricycle units in the locality. I immediately allow them for economic reasons. We have 6,000 tricycle drivers in the city, and that would account for 6,000 families. So children, and children, so many children. Pero ginawa namin, bago namin sila payagan, nag-mass testing kami.
Mhm.
Uh, we tested for 5,465. We found 4 positive COVID-19. 2 of them non-residents of Marikina. Only 2 are residents of Marikina. So, happy to note kami. Tapos may surveillance testing kaming ginagawa ngayon.
Mhm.
Hindi pwedeng one-time testing, may surveillance, random testing. Uh, Kaya para makapagtrabaho. Ang quarantine effective para to avoid transmission. Pero economically, I think it's not really viable. It's not
Mhm.
really viable. Kaya what we're suggesting, I'm suggesting even to the national, is not to do a barangay lockdown, not to do a city-wide lockdown, but simply to do a neighborhood lockdown or a home lockdown or yung ganun lang, maliliit lang, kung saan lang talaga yung may transmission, may community transmission. And we could do that dahil may testing capacity kami. We could test, we could do contact, we could do effective contact tracing. Pero if you don't have the testing capacity, talagang ganon. Ang mindset mo, ila-lockdown mo yung buong metropolis, buong metropolitan Manila, Manila area.
Mayor, for my final question for today, what are you expecting this pandemic to become in the coming months? And how is Marikina preparing for that? How is Marikina preparing for the so-called new normal where we all have to go out into the world again and try
Uh,
to live a normal life and try to earn
we're
money again?
we're strict with our social distancing measures, but we cannot simply remind people to exercise social distancing measures. There should be a reconfiguration in the workplace, in public areas. There should be signages, markers, for example, or barriers. Those things we need to introduce. Physical, physical improvements or physical facilities, uh, so that people can practice social distancing. Uh, Reconfiguration of various areas, schools, uh, our city hall, for example, our service areas, yung mga ganon. Yung mga eskwelahan namin ngayon, maring hindi pa talaga magagamit, pero mini-maintain namin yung physical order. Plus, we're thinking of what will happen in the event na students will be asked to report to class physically or will have a face-to-face schooling. Uh, we're preparing our connectivity. We're about to undertake installation of fiber optic for the whole city so that everybody will be connected and uh, digital uh, platform is necessary and imperative at this point. So to do business, to for school purposes, for education, uh, we're preparing for the new normal this coming school year.
Mhm.
We're adopting a blended approach. Uh, we're buying now uh, gadgets or uh, tablets for our pupils or students. Um, Personally, I look into the what you call it content of the learning materials to be sent to the pupils. I try to understand what learning competencies should be achieved by our pupils because we could not afford for this batch or this year of students to lag behind in terms of knowledge acquisition and skills competency. So, importante ito eh. Dapat pinag-uusapan sa national na eh. Dapat may template na nga sinusunod. Pero seemingly, we are here in the local government. need to exercise our own initiatives to best deliver to our constituency yung educational requirement nila. Uh, uh, we're putting up super health centers. We call it super health centers. Uh, Larger in terms of area, centers not only for consultation, but health centers with diagnostic capacity
Mm.
and an integrated health service delivery, meaning we're putting also a pharmacy inside the health
Wow.
center. So you go to a doctor, you consult, and if you need to be diagnosed, there's the capacity there in the center. And before you go home, of course, people who will go to the health centers will have no means to provide on how to take care of themselves. So we put a pharmacy there. We're putting 4 super health centers. WHO incidentally will benchmark with Marikina
Ah,
for new normal in putting up this health centers. So they telling us that they saw some of our health centers. Mga malalaki yung floor area namin, mga 1,000 square meters. Uh, 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 four, 3 to 4 story building ng mga health center. It's like a mini hospital. Project na namin to dati pa, pero ito nga, na inahasten namin na ma-open dahil nga because of this COVID, lalo na pag dinowngrade pa further yung quarantine natin. We're expecting more cases to come in. So we're preparing our health delivery system to address the increase in the cases of COVID-19. Hindi namin sinasabing kami pinakakonti, magaling kami. Hindi. Tingin ko dapat ang indicator really is that do we have the capacity to treat our COVID-19 patients uh, 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 given the medical standard of treatment, and are we able to reintegrate them to their families and to their communities, then becoming again a productive member of the society or the community. Yung ganon. Tingin ko that's the true measure of it. Kaya ako tinitingnan ko more on this recovery.
mm.
For example, in our case, we have 300 confirmed cases and we have a 50% recovery rate. As based on our data, we have 150 plus recoveries uh, this confirmed case namin. So the challenge will remain. The virus will still be here. Miski sabihin mo may vaccine.
Mm-hmm.
So having a vaccine, the next question is how to provide vaccine for everybody. Do we have enough resources to provide vaccine to everybody? Or will the vaccine be affordable to the public?
Okay. And that's all the time that we have. Mayor Marcy, thank
You-
you so
yeah,
much for joining us today.
yeah, thank you, Mara. Thank you.
Ayun, thank you so much, sir. Again, that's all the time that we have. Once again, that was Mayor Marcy Teodoro of Marikina. I am Mara Cepeda. This was Rappler Talk. Join us again next time.